News tonight, hospitals all over the country and here in Connecticut expected to lose Medicare funds in the next year.
That's due to a new federal policy penalizing hospitals for high readmittance rates. News 8's medical reporter Jocelyn Memento looks at what this means for Medicare patients.
Well, Sonia and Darren, I checked in with some of the hospitals on the list, and they now have programs in place to reduce the number of people readmitted within a month of getting discharged. It's basically a win-win for the hospitals and Medicare patients.
High readmission rates at hospitals like Yale New Haven within 30 days of discharge have driven Medicare reimbursements to more than $17 billion a year. Based on numbers from July 2008 to June 2011, under a new federal policy, many like Yale New Haven Hospital stand to lose those funds in the next year. It comes down to Medicare looking into how hospitals are providing that transition of care, something the hospital is also addressing.
We found out that there were these gaps. So our plans where we had in the hospital weren't getting communicated effectively out into the skilled nursing facilities, to the home health agencies, and patients at home were left with questions about, what do I do about this medication? When do I go see my doctor?
Dr. Grace Jenk oversees the Greater New Haven Coalition for Safe Transitions and Readmission Reductions. CoStar is a community-based program aimed at reducing the number of readmissions.
I think there's a subset of patients and families who are quite frustrated about having to come back in and time again for readmissions.
Social workers from the Agency on Aging of South Central Connecticut.
Good thing is he already has Medicaid, so it'll be a lot easier to get services in place.
Monitor patients closely.
They will make follow-up phone calls and they'll go over instructions with the patient, make sure that they have transportation to make it to their doctor's appointments, make sure that patients understand what symptoms to look out for so that we can potentially prevent a readmission.
The biggest benefits? Overall lower health care costs and improved continuum care for patients.
The hospital of St. Raphael is also involved in CoStar. Dr. Jenk points out that there will still be patients who will need to be readmitted for acute care within a month of being sent home. The program took effect in May and has since signed up 200 patients.